Today's webinar is titled From Trial to Triumph, Robyn's Pioneering CAR T Therapy Journey. Let me take a moment to introduce our speaker, Robyn. She graduated from undergrad at Wake Forest in 3 years as a biology mathematics major and then finished medical school at UNC Chapel Hill. After finishing her residency and fellowship in diagnostic radiology with a body imaging focus, she returned to North Carolina to practice radiology. In 2011, she was diagnosed with DLBCL, obtaining remission from standard R-CHOP for 4 years, but the cancer returned. Subsequently, she had more therapy. When the cancer returned a third time, Robyn researched and found a clinical trial of CAR T, and in 2016 was one of the first patients in the world to get CAR T for lymphoma. Now, Robyn is cancer-free, still practices medicine as a radiologist, and is a patient advocate for blood cancer patients. She is married to Scott, a former nuclear submarine officer, and they have 3 grown children. In her free time, she loves to travel. And now I will turn over the time to Robyn.
Hi, everyone. I'm so glad to be here, and I'm very honored to be asked. As the intro showed, I am a 3-time diffuse large B-cell lymphoma survivor. Quite a sort of an interesting achievement, but glad to be here. I was asked to actually talk about my story because every single cancer patient story is very unique. And what HealthTree is trying to do is connect patients so they can talk to each other and share parts of their story and get some validation as to their symptoms and their treatment course. And I think this service is very valuable. So with that, I'll go on with my story. I was first diagnosed in May of 2011. People always ask, how did you find out you had cancer? Well, I had no symptoms, except that I was watching TV one night and I literally felt a lymph node that was over my collarbone. That's called a supracollicular lymph node. And as a radiologist, I knew that that was not good. That's never a good sign. Those lymph nodes are associated with cancer invariably. Usually it's lung cancer or breast cancer or stomach cancer, ovarian cancer. But in this case, the next day, I went to my doctor and they ordered a CAT scan. And I looked at my own scan when I got off the scanner, and I noticed that I had all these lymph nodes in my neck. None of them were palpable except for this one here, but there were way too many lymph nodes. And at that point, I knew I had lymphoma because this is what I do for a living. I diagnose people. So I had a biopsy that was just a needle biopsy 2 days later. And then those results, I looked at the slides with the pathologist, and we saw a lot of B cells, and he said, this looks like B-cell lymphoma. And so it was very upsetting, but I went to the oncologist the next week and started chemotherapy. And I used initially the standard therapy in 2011, which is called R-CHOP. Many of your patients will have received that, or sometimes these days you might get something different like R-EPOCH. But R-CHOP was standard. And I responded very well to it. Actually, I was in remission within 3 months, but I completed the entire six rounds of therapy. I did very well with therapy. I had nausea and I felt lousy, of course, lost my hair, but I would have chemo on Friday and go to work on Tuesday, which is, a lot of people can't do. But I was fortunate. I got the Neulasta shot. Actually, I used Neupogen because I didn't tolerate Neulasta, and I was able to work and keep my white counts up. And so I was in remission for 4 years. We thought I was out of the woods because at that point you're usually a cure, but unfortunately the cancer came back. And once again, I felt another lymph node in my neck, and this time it was toward the back of my neck. And that time they actually did an excisional biopsy to remove the lymph node to confirm that it was indeed relapsed lymphoma. The first time I was diagnosed with something called germinal cell lymphoma. Second time it was an ABC subtype, which is a little controversial. They don't know whether my first biopsy was inadequate or perhaps the tumor changed, but nonetheless, ABC is much more aggressive. So they treated me extremely aggressively. I actually received second opinions from MD Anderson and actually went to MD Anderson for opinions. I actually got remote opinions from Sloan Kettering and University of Nebraska. And the consensus was that I should have an autologous stem cell transplant. What's required for that is they gave me rice salvage chemotherapy, which is a terrible chemotherapy. You're in the hospital, you're very sick. but I did okay with that. But I also had to have something called intrathecal chemotherapy, where they put chemo into the fluid that surrounds your spinal cord by doing a spinal tap. And, I had 2 of those, but with all of that, I went into remission. And then I went to a different institution for a stem cell transplant. This was autologous, so that meant they had taken out my stem cells beforehand, and they were frozen. And then they give you what they call myeloablative chemotherapy. In my case, I got something called BEAM, and it totally eliminates your bone marrow, puts you at risk for all sorts of infections. And then they give you your cells back. And then when you get your stem cells back, they engraft into your bone marrow and they start making new cells. So an autologous stem cell transplant is really just a chemotherapy rescue kind of procedure where they're giving you such high dose chemotherapy, they give you stem cells. Whereas an allogeneic transplant is where you use somebody else's stem cells. And that's important when we talk about this later. But anyway, I got my stem cells back. I was doing fine, but then I became septic, which is pretty common. I got an infection from one of my lines. I had several lines. And so they took that out surgically, and I was in the intensive care unit. And I had something called septic shock, which is, no fun. Low blood pressure, really high fever, a bit confused. They had to give me medicine to keep my blood pressure up, but I got through it, gave me a lot of antibiotics. I went home. I went home after about 3 weeks, and I was very sick when I came home. I was very swollen. It's really difficult to walk, very difficult to eat. But gradually I started getting better. But unfortunately for me, I had actually recurred for a second time on my neck, and they thought that I should actually have consolidative radiation therapy. So in that case, they were going to radiate my neck. And some of you may have had radiation, head and neck radiation. They have this device they put over your head so that you're on the table and don't move. And then they radiate the lymph nodes. And unfortunately, I had a lot of side effects from that. I wasn't able to eat solid food afterwards for about, 3, 4 months. I lost all my taste for almost 5 months. I also got intractable nausea, permanent. I have a lot of permanent side effects from the radiation. I got dry mouth, which I still have, and then also it radiated my thyroid. So my thyroid no longer functions. I knew that was a side effect. The other stuff was a big surprise. But I did achieve remission, and they thought that I would have long-term remission because I had responded so well and I'd gotten through things, and I was recovering very well. I went back to work. Gosh, a couple weeks after radiation therapy, I was off work for about 3.5 months. So I went back to work part-time initially and then ramped up to full-time. And I was really enjoying living my life. I was actually on a bucket list trip to the Galapagos Islands with my then 16-year-old son, maybe he was 17. But again, while we were in the Galapagos, I felt another lymph node. And it was actually this time under my chin here. And I knew I'd relapsed. I didn't tell him. So we enjoyed our trip, and I came back, and then the testing started. I had another PET scan, and the first 2 times I had stage 2 B-cell lymphoma, 2E, because I had lymph nodes behind my nose. The third time it came back, I had stage 3, and I had lymph nodes in my right groin. I had lymph nodes in my armpit. And to confirm diagnosis, I had surgical removal of an axillary lymph node in my armpit, and that showed relapse. What happened after that was sort of interesting. The standard of therapy was an allogeneic transplant, and I'm an only child, so I have no siblings. So there's nobody that would have been a match. Also, I'm multi-ethnic. Have a lot of Mediterranean heritage. Then I threw in some British heritage. I'm a good old American mutt. And they thought I would have a match, but I had no match. Nothing was even close to being a good match. The best match I had was my biologic son, who was only a half match. And I knew that with an allogeneic transplant, it's a rough procedure. Only about 30% of the people actually get remission and a cure. And of that, a lot of people get something called graft versus host disease, which limits their life. And I didn't want to limit what I like to do, because I love to travel, I like to exercise, and I enjoy working. So I had actually been doing some research online myself. And on this site, which anyone can access, www.clinicaltrials.gov, I started looking for CAR T trials. I did this on my own. No one did this for me. There was no one to talk to. There was no advocacy groups at that point. LLS had not gotten into CAR T. CAR T had been used for leukemia, but it was just getting going for lymphoma. But I sort of knew it was the answer for me. So I emailed, and my husband, the both of us together, emailed every single place in the United States and in Europe that were doing CAR T trials. At that point, there was maybe, I don't know, 30 or 40 of them. And there were no spots available initially. And of course, my cancer is starting to grow pretty rapidly. And my doctors are telling me I need treatment. But eventually, it was really sort of a little miracle. Somebody emailed me back from Ohio State. They actually had a Novartis, it's now a Kymriah trial. It was called the Juliet trial. It was the phase 2 trial for that product, which is the same product that was the first one approved for leukemia. So I immediately got on an airplane and I flew to Ohio and I got accepted into the trial. I signed all the paperwork. People who are actually doing trials, they stress out a lot. The bottom line is I knew I was going to do this trial. It really didn't matter what the paperwork said. I knew there were risks. There were risks with life. There were risks lying there. But I knew this trial was for me because I knew my chance to survive with an allogeneic transplant was very low. So we signed up for the trial. And I don't know how many of you know about CAR T. I have to talk a little bit about CAR T. It's an amazing therapy. It's genetic therapy where the doctors take your T cells out via an apheresis machine. If you've ever given platelets, it's very much like giving platelets. They take the blood out of one arm and they put it through a machine, and it actually separates the blood cells. So then they get a bag of your T cells, and then they take the rest of your blood and put it back. So it's a long procedure, but the apheresis to receive T cells took me about 5 hours. If you ever do apheresis to give platelets, it takes about an hour. Some people who get apheresis, it takes longer. But anyway, they take your T cells out, they freeze them, put them in a bag, and they send them to a lab. Depends on which type of CAR T you're getting as to which lab you go to. But in the lab, they use a viral vector, which is basically, a virus, to insert a different protein onto the T cell. And the protein that they insert on CAR T for leukemia and lymphoma at this point is usually called a CD19 protein because the CD19 protein is carried by all of the B cells. So they genetically alter these T cells. They grow them in a petri dish, basically, and then they freeze them, and send them back to be infused into the patient. And once the T cells are infused in the patients, they go into your body and they bind with the cancer cells and they blow them up. It's very much like a heat-seeking missile, if you think about it. And then once you are going through that, your body can have a lot of reactions because obviously your cancer is being blown up. So you can have this immunologic reaction like fever, and you feel, malaise and everything. But then magically, a lot of times it's over and the T cells have done their work and they seek out all the cancer. But that's CAR T. So signed up for CAR T. They took my cells out. I went home. Unfortunately, my cancer was growing pretty rapidly, and it was early in trials, and the T cells took a long time to modify. So they gave me an off-label medication called ibrutinib. And then this is off-label treatment. This was not standard of care, but they know it's good for ABC subtype lymphoma, and they still use them subtype now it's on label. So I did ibrutinib, and there was a lot of delay in my cells. The FDA had to prove my cells. So the FDA held up my cells for like 6 weeks. We didn't know if I was going to get them. But finally, on September 14th, 2016, I got these magical T cells. They were in a little teeny bag about this big. The infusion took all of 10 minutes. There was probably 20 staff members in our room because I was one of the first patients. They were all clapping, and there we go. So the T cells were in, and we just were going to wait. But I didn't have to wait long. It only took about 24 hours where I developed a fever. So we thought that was a good sign that the T cells are working. By day 5 through 8, I developed a high fever and low blood pressure. I was outpatient, but days 5 through 8, I was inpatient. And so they monitored that very closely. Because I was in trial, the only thing they could give me was Tylenol. Nowadays, you're not in trial, and they give you stronger medicine to take care of the fever. But then I went home, and by the time I went home, all the lymph nodes that were in my neck, the lymph nodes from my armpit and my groin, they had melted away, literally like an ice cube. They were just gone. I felt good. I felt weak. I kept walking all the time. And through this whole therapy, I kept walking every day. to try to keep my strength up. Eating was difficult. I was trying to make sure I ate protein and healthy things. I'm not just trying to keep my strength up. But 4 weeks after my infusion, I went back to work. And I was working part-time initially, like 20 hours a week, and then I went to 30, 40. By 3 months afterwards, I was working full-time. And also I got open water dive certified. And 6 months afterwards, I was again declared in long-term remission. 6 months is a big deal. And at that point, we went diving in French Polynesia, which was a bucket list trip for me. And now here I am. It's been almost 8 years after I got T-cell therapy. I'm doing wonderfully, obviously. I do have some side effects from the chemotherapy, from the radiation, and mainly from the radiation, some of the other chemotherapy, low bone density, dry mouth, no thyroid, those things, but it's still minor when you consider that I'm alive. And, you know, I actually run this CAR T site on Facebook where there's 6,000 members, and there's a lot of different stories. I want to emphasize that every patient is unique. I've done extremely well. A lot of other patients have done that well. Other people have more terrible side effects. I had cytokine release syndrome, which is a reaction to T cells. I only had grade 2. Some people get grade 4. Someone get neurotoxicity. Some people get nothing and are still in remission. It just varies. So there are no guarantees, but I'm extremely grateful. And I just want to say 3 things of advice, 3 points for anyone listening here. And this is whether you get CAR T or you just have lymphoma, or you have any kind of blood cancer or any cancers. First of all, you need to be your own advocate. In my situation, none of my doctors wanted me to have CAR T that had been treating me because that wasn't a standard therapy. But I actually got some other opinions, and I found some younger doctors who thought that I was a perfect candidate for it. So you need to always ask questions. You need to ask for data. If somebody says you need to do this, ask for the data and realize that nothing's going to be 100%. The other thing is it's okay to get a second opinion. Doctors are human. I mean, you can't be all knowing, and every case is unique, and it's important to actually talk to a few other doctors, especially if your case is unusual, like mine. When it started, it kept coming back. So be your own advocate, and it's always good to have someone by your side if they can be there to help you. The second thing is lifestyle. People get obsessed about lifestyle, about, am I going to go on this diet? Do I need to go and move to a farm? Do I need to get rid of my cat? I think everything in moderation. You need to exercise. That is the most important thing. And it doesn't mean you need to go to the gym. You can just walk around the block. But they did do studies in breast cancer and prostate cancer that if you exercise, you had a longer remission rate, a longer term, and a higher chance of cure. And as far as diet, be logical. Everyone knows that Twinkies are not good for you. So, eat lean meat, eat fresh vegetables, try to keep the calories down. It's better to try to have your BMI at a normal BMI, but don't go crazy. Some of these extreme diets can actually make you sicker. And, any diet or any type of supplement, you should run it by your doctor. So the third thing that I have to say, and this is actually probably most important, is go ahead and live your life to the fullest. This cancer is very frightening. It changes your life. A lot of people mentally have PTSD from all of the cancer therapies and the infusions. I mean, I know I do. But you need to leave your life, take the trip, go to the special dinner, go see family, go to that concert or that show. I mean, just savor each moment and try not to live in fear. And that's the most important thing. So thanks very much. And I think they're going to open this up for questions.
Thank you, Robyn. Let me share my screen real quick. Thank you so much for that presentation. It's now time for the discussion part of today's webinar. If you have any questions for Robyn, now is your chance to ask your questions. This time is specifically set aside for our community members to have a chance to talk to our incredible presenters, so please feel free to ask any questions. As a reminder, you can ask a question or make a comment by typing in the chat box or by raising your hand if you'd like to ask a question verbally. If raising your hand once you are called on, then you can unmute yourself and ask your question. Let me see if there's something in the chat. Okay. Dan says, hi, when I was first diagnosed with DLBCL, Robyn's story on the patient story on YouTube gave me a great, oh, sorry, that went away. Gave me a great hope. I am now in remission after 8 rounds of R-CHOP, and I want to thank Robyn for being brave and joining the early trial. And then Maria says, same here, Dan. And then, perfect. I have some questions, I think, for you. So my first question is, you mentioned you started treatment a week after you were diagnosed. Is that typical for patients, or is there usually a longer waiting period of tests and things like that? Oh, you're muted. Sorry, Robyn.
Given that I do body imaging and PET CT, I've seen that happen to liver patients. It sort of depends. It depends on when they can get the biopsy done. Sometimes I remember a case recently where we had a patient who had primary breast lymphoma, and she had her biopsy, and her report was in 4 days later, and her chemo was 1 week later. But it was the fact that she got the biopsy and they got the diagnosis fairly quickly, and they were able to get her in. But nowadays there can be significant delays. There is a national shortage of doctors in general, oncologists, radiologists. So sometimes just to get the appointment can be longer. So again, be your own advocate. Advocate for an earlier appointment. Take cancellations, whatever they have. But I would say it's more average, I would say, to be 2 or 3 weeks, but it's usually fast with lymphoma, especially with diffuse large B-cell is an aggressive lymphoma, and they want to get it treated as soon as possible.
Good, thank you. My next question is, how did you tell your family about your diagnosis, and how did they react?
Well, it was actually Mother's Day weekend. I knew that I had lymphoma that weekend, but because I had looked at the slides on Friday, and I told my husband, but I wasn't able to tell our kids until the next week. But I knew I had to because I was starting chemo. So I just sat our kids down, who at that point were older. I mean, they were middle school and high school, 3 kids, and it was hard, and it was hard on them. I mean, to see your mom, throw up a lot and lose her hair, it's not great. But they were troopers. They really were. So I don't think that there's just not a great way to do it. I think when you have younger kids, there are some books out there that that will introduce the cancer concept to kids. Because I know a lot of people on the site have brought those up.
Perfect, thank you.
Sure.
Let's see. I have some more questions. What advice do you have for patients considering a clinical trial? I know sometimes that seems really scary to a lot of people.
Yes.
What advice do you have to make them feel better about that?
I don't know. I think the reason, what I was looking at it is what is the alternative? So the clinical trial may sound scary, but what is your alternative? My alternative was an allogeneic transplant, which was far more scary to me than the clinical trial. And so I see that on that site where some people are like, gosh, these side effects for this trial or even CAR T are just really scary. Well, what's your alternative? Either hospice, or are you going to go to have a bone marrow transplant, which has a higher mortality rate? So you have to be honest about what your options are once your cancer comes back. And it's a brutal conversation you sort of have to have with yourself in your head. I hope that answers the question. But people who have faith, whatever their religion, do seem to do better with that. But it is a struggle. So I don't think there's a great answer. But I think it's the best answer I have is, what is the alternative to the trial, and how scary is that?
How did you manage doing a clinical trial in Ohio? Did you just have to stay there for weeks, or?
We got a VRBO for 30 days. We had to be within 30 minutes of the hospital. And of course we were, 5 states over. So that's what we did. And then I had to go back every gosh, it was every month at first, then every 3 months. And because I was in a trial, Novartis paid for that, which was nice. And Novartis paid for the VRBO,
Okay.
which was nice financially. But that was, a trial. Nowadays, if you're getting CAR T, a lot of Yescarta, the Kite Pharmaceutical, and Novartis will often pay for some of the lodging associated with CAR T, since you have to be so close to the hospital.
Okay, thank you for that clarification. And then how is your life different from before you had DLBCL till now? What's changed?
Well, thankfully, I'm just a lot older. So part of it's just the fact it's been a while. I mean, 13 years, so that's something. But I don't know. I'm very grateful. I think I have a tendency to what I call live like you're dying. So I'll book that trip. Usually it's trips because I love to travel. I've done some adventure stuff like climb mountains. I mean, I climbed up to a top of a volcano in Chile. It's like 18,000 feet. That was pretty cool. I didn't know if I could do it, but I just wanted to prove I could. So those are the kind of things that I do that work for me. Everyone is unique, however. So that's different. I'm really willing to spend the time and the money in between working to pay for things. If I can.
Thank you. And then you said you had some side effects during and after treatment. What did you do
Oh
to manage
yeah.
those side effects? Do you have any tricks or tips?
Um, the with nausea, it's counterintuitive, but walking actually helps nausea. It does diminish it. Also, you can talk to nutritionists for the nausea side of it, because that was most of it with all the chemo, about changing your diet to, they call it like a brat diet, where you eat very bland things like bananas and stuff like that. So I would do that. Some of the other side effects, I just had to survive. I have to say, I was fortunate in the fact that I did have some pain, but it wasn't as severe as pain as some other folks have. So when the lymph nodes were shrinking, they really hurt. And actually, that's something that people always ask too for CAR T. Where your tumor was, it hurts for like 2 years. It's weird. It's like these phantom pains. They just come back. And I mean, I still sort of feel something in my left axilla and armpit. So yeah, it's sort of weird, but I just live with them. You do what you have to do. You change your schedule. You may have to sleep more. You may have to change your diet in general so that it's more tolerable. So I don't think there's any easy answers. You just have to figure out what works for you.
Perfect. And then during and after treatment, what things did you do to support yourself physically and mentally to get through?
One thing I really highly recommend is any of these folks who go through this. Most cancer centers, not all, have a psychologist on board. So I talked to a psychologist who was specialized in dealing with cancer patients. So this is very traumatic. I mean, I really think anybody who's gone through cancer has their version of PTSD. I know if I go into an infusion center, I just want to walk out. I did go in for a couple of IVIG treatments after my CAR T, which was recommended, and just going into the room made me want to throw up. And I don't think my reaction is unusual. So yes, get a therapist. The other thing is, one of my oncologists recommended monthly massage, and I did that for a long time. Also recommended meditation and yoga. I think yoga is extremely helpful if you can do it, because it improves your core. And that's a lot of the strength you lose when you're on chemo, because you get muscle wasting and you really just don't feel well. So in summary, I would say see a therapist, consider exercises like yoga, walking, and talk to a nutritionist and see if those things can help.
And then obviously you probably had caretakers like your husband or your children. What advice do you have for caretakers? What helped you the most?
Well, first of all, caretakers, deserve a big, like hail to the chief. I mean, it's almost harder for them because they're seeing their loved ones suffer. And I think I think they should actually go to therapy. I really do. And for caretakers, they need their own caretakers. So for those caregivers out there, you need to let your friends know what's going on with you, and encourage your friends to do stuff with you. I think having cancer is very isolating, and I know my husband got so tired of seeing all of his friends, and the first thing they would say is, "How's Robyn doing?" I mean, they don't ask how he's doing; they ask how I'm doing. And meanwhile, he's worried about losing his wife at a young age and raising 3 children. So caregivers need to be kind to themselves, and they really need to spend some time with friends. For my husband, the best thing for him was to go golfing with some buddies. So whatever, if you're the caregiver, whatever you like to do, if you're in a book club, if you like to go to museums or shows or whatever it is, you need to take care of yourself mentally so that you can be there for your spouse with cancer or your significant other with cancer.
I appreciate that. Thank you, Robyn.
Sure.
I'm not seeing any questions come in the chat. Dan shared a little bit about his diagnosis journey.
Yeah.
To read that.
Yeah.
If you have any comments on that, you're welcome to share.
Yeah.
Otherwise,
I am. Yeah. Cancer is just awful. I mean, it's so unfair. It's definitely unfair. And it's amazing that we can get through it, but we can. And what you're doing, with HealthTree is just fantastic to actually have someone that people can talk to. When I was going through CAR-T, one of the reasons we have done this Facebook group is there was no one to talk to. No one. Zero, nada, zip. The doctor I was a second case. She's absolutely brilliant, but she had never seen a case before. So to have people to talk to, I think actually helps. So one other advice I would give is reach out to someone who's had the treatment, because there are a lot of different weird side effects or feelings. And, the one comes to mind that I've forgotten now. After you had the CAR-T, a lot of people get these weird joint aches. It's like you have arthritis all of a sudden, and then gradually it goes away. It's some type of a side effect. And it's important to be able to bounce this off people just so they're not so worried. So having cancer buddies is really nice, very key. And I do a lot of breast cancer work because I do a lot of mammography, and the breast cancer community is fantastic. They really get people connected. Blood cancer has been a little slower on that. LLS has done a great job, and what you're doing is magnificent.
Thank you. I appreciate that. There's a couple of comments in the chat
about the Facebook group. Yeah.
How helpful Facebook groups are. And so that's great to hear.
Yeah, we try to keep it upbeat and positive, but it's a tough road.
Perfect. Thank you for sharing that. And we can move on if there's no more questions. I'll forward the slide. And before we go, I wanted to highlight the Track My Disease feature in HealthTree Cure Hub. Once you've connected your medical records, the Track My Disease feature provides you with the ability to gain one-of-a-kind access to your health information, encompassing lab results, genetic profiles, treatment histories, offering you the invaluable insights into your own medical journey. On the screen, I have a link to HealthTree Cure Hub, along with the email address for our amazing patient navigators who are available to help you create an account and connect your records. I will also include information on how to enroll in HealthTree Cure Hub in our follow-up email, so you can look there. And then we have some upcoming events on the link to sign up for any of these events is found at the bottom of this slide and will be sent to the follow-up email within 48 hours after the completion. Monday, August 26th at 2 p.m. Eastern Time, we have a webinar on treatment options for DLBCL with Dr. Phillips. Thursday, September 5th, we have a DLBCL podcast that will be published, and it will be about research advancements for HIV-associated DLBCL. And then Monday, September 18th, we will have a webinar about tumor lysis syndrome. As a reminder, we would appreciate you taking a 2 to 3 minute survey to share about your experience today, and Zoom will prompt you to take this as soon as we leave this session. And then you can also submit any ideas for future events through this survey. As always, I would like to thank our sponsors for whom without this would not be possible. That's Regeneron and Bristol Myers Squibb. I would just like to give one more thank you to Robyn for taking the time. She's very busy, so thank you for being here and sharing with us. And thank you to all of you who help us build our DLBCL community. I've added my email to this slide. Please don't hesitate to reach out if you have any questions about HealthTree or any of our programs. I appreciate you all, and I hope you have a great rest of your day. Thank you, everyone.
Bye, everyone.
Bye. Thank you.
Bye. Thank you.